Hi, I'm Lavinia Butler, and welcome to Lovering and Company. Our guests and topics today are about preterm labor issues, and we have an exciting panel to talk to you about that today. With us is Dr. Gloria Rashad Davis, and Dr. Davis is a professor of obstetrics and gynecology at and director of the Women's Center at Meharry Medical College. And we have, with us, Susan Drummond, who's an RN and with prenatal, and this word is regionalization coordinator. Did I get that right, Susan?
You did.
Good. At the Department of OB/GYN at Vanderbilt.
Yes.
Welcome, Susan. Glad to have you with us, too.
Thank you.
And Ashley. We have Ashley Turner, who's the March of Dimes Ambassador Mother. Thank you for being with us today, Ashley.
Thank you for having me.
Great. Well, now we're going to talk about preterm labor issues. Well, what is preterm labor? I mean, exactly explain what is it, or the signs of that?
Well, when you talk about a normal pregnancy, the gestational length of a normal pregnancy is 40 weeks. So any delivery that is earlier than 37 weeks, so between 20 weeks and 37 weeks gestation, is preterm labor, because really before 20 weeks it's really not considered a viable pregnancy.
Well, who is at risk for preterm labor, and how do you know? What are the risk factors of that?
Well, there's quite a few. I would say the women who are at greatest risk would be those that have had a previous preterm delivery, or who are carrying a multiple gestation, twins, triplets, or who have some sort of abnormality in their uterus or cervix. But there are also some lifestyle risks, such as long working hours, stress, age risks. Women who are young, less than 17 or over the age of 35 are at greater risk.
Well, how do I know? Well, what are the causes? What causes it? What causes preterm labor? And why does preterm labor really occur at all?
That's sort of a Nobel Prize question.
Oh, okay. Thank you,
Okay.
Dr. Rashad Davis.
There's a lot of
Causes?
factors
Okay.
that contributes to preterm labor, but the exact cause of preterm labor we don't know. You know, there may be a subclinical infection like a chorioamnionitis. There, certainly can be structural reasons, whether it's a malformation of the uterus, fibroids. So there's a myriad of things that contributes to it, but the actual cause is still unknown. There's a lot of research going into that, a tremendous amount supported by the March of Dimes, NIH. So we are struggling with trying to really identify what the core hypothesis is.
Well, I know this, with the March of Dimes and the Metro Public Health Departments, that it's a community project that called FEMO, that we call for short, but it stands for, if I guess right, the Fetal Infant Mortality Review Program at Metro Public Health, and I know the March of Dimes as a partner with that also. And Susan, Ashley, rather, as an ambassador with the March of Dimes, I know you have had issues or problems with preterm labor.
Yes, ma'am. My little girl is 5.5
Oh, now
now.
don't say ma'am.
Oh, sorry.
Lavinia, be good.
My daughter is now 5.5, but I had her at 27 weeks as the result of going into preterm labor. The March of Dimes, as you said, does a lot of research. They fund a lot of research. People might know them as a fundraising organization, but the funds that they raise are partly to go to research and partly to go to education, so that people do know the signs of when they're going into preterm labor. I know for myself, I was not really familiar with the signs, and I missed a couple, and it, like we were shopping, and I remember being crouched down in a department store because my back hurt and I just felt not good. And it wasn't until the next morning when I woke up with actual contractions that I contacted my doctor.
Oh, wow. Are there other signs and symptoms?
Yes, I think that when we try to educate patients on what to look for, backache is one, and that's not one that everybody knows about.
Right.
Also, just pelvic pressure. Some women actually do report uterine contractions, but one thing that I've heard more often on the telephone is them saying, I think my baby's balling up inside. And that is a contraction, but they don't really think of it that way. But they think their baby's just tightening and relaxing. It's really their uterus.
Or they may have a change in vaginal discharge, a little bit of bleeding. That can also be a sign of preterm labor.
Oh. Well, now, right. Oh, now that's the first sign that I would think about would be the bleeding. But the other signs, it's good to know. Back pain, I wouldn't have thought that either.
Well, it's very confusing because if you think about the fact that pregnant women oftentimes complain of back pain, but paying attention to anything that really is sort of rhythmic, recurring, that's a key element.
Well, we're going to show a little short video, and we'll come back and talk more about this in just a minute.
In this video, we're talking about signs of preterm labor and what to do if they happen to you. Preterm labor is labor that happens before 37 completed weeks of pregnancy. Babies born too soon can have serious health problems at birth and in the future. Any woman can have preterm labor, but if you've had a preterm labor before, you're more likely to have it again in the future. Call your provider if you have even one of these signs of preterm labor. Contractions that make your belly tighten up like a fist every 10 minutes or more often. Change in the color of your vaginal discharge or bleeding from your vagina. The feeling that your baby's pushing down, this is called pelvic pressure. A low, dull backache. Cramps that feel like your period, or belly cramps with or without diarrhea. So you just listened to that whole big laundry list of preterm labor signs and symptoms. Have you experienced any of these?
No, thank God.
No, yeah, exactly. If you ever did, or if a coworker, or friend, or family member did, the first thing to do is stop what you're doing. Try to lie down. We recommend on your left side, and that's really just to try to keep the uterus off your blood vessels. Drink some water, drink some juice. We don't recommend coffee or soda or caffeinated beverages. Basically just try to take care of yourself a little bit and help alleviate the symptoms by rest and some fluids. But you'd want to keep in touch with your provider to see when you need to be evaluated. The trick here is with preterm labor, we want to catch it before it really becomes intense, before the cervix starts to open, before the water breaks. And so if we can help intervene early, then we can try to make sure that mom and baby are as healthy as possible. If the signs get worse or don't go away, call your provider or go right to the hospital. If the signs do go away, take it easy for the rest of the day. Getting help quickly is the best thing to do. Remember, preterm labor is labor that happens before 37 completed weeks of pregnancy. Any woman can have preterm labor, but if you've had preterm labor before, you're more likely to have it again in the future. Call your healthcare provider or go to the hospital right away if you have signs of preterm labor. Visit marchofdimes.com for more information on preterm labor.
Wow, well, thank you. That video was quite interesting. Well, Dr. Richard Davis, tell us, what should a person do if they, feel that they have preterm, symptoms?
Well, certainly the best thing to do is to report that to your physician. If you can't, for whatever reason, immediately get in touch with your physician, then calling the hospital, but definitely not just ignoring it and thinking that it's something that's insignificant. It's really important for women to be conscientious of what those symptoms are and what the risk factors are. Because those who are at increased risk, they may be monitored more frequently by their physicians, but there's also a large number of women who have no history of preterm labor but experience preterm labor.
And that's what happened with me. I had no risk factors, I had no history, and I did go into labor, and I kind of hesitated to call because I thought, well, it's my first child, I'm just misinterpreting what's happening, and I don't want to bug her because it was a Sunday. So I think I waited longer than maybe I should have, and I think looking back, I should have called sooner.
How long did you wait?
Oh, I timed the contractions for about 4 hours before I called.
Wow.
So
Wow.
And at that point, your contractions were how often?
about 6 minutes
About
apart.
6 minutes
6
apart.
minutes apart.
See, so
And she
you know,
said, "Come on
anything that's
in."
more frequent than
Yeah.
10 minutes or
When
less.
they're having complications, patient having, you know, most women do not call the doctor. That's the whole thing. It's about, you know, why don't women call the doctor? They always said men never go to doctors and all, but I guess, you know, when you were saying that you were hesitant in calling because you thought maybe
did.
it's just, you
It
know.
was Sunday. I read the little Braxton Hicks part of my What to Expect When You're Expecting type book a few times before we called, and you know, it was Sunday. I didn't want to bother her, so glad that I bothered her because it needed to be.
And people said that these symptoms are normal, and so
Right.
I guess it's one of the reasons people think that I'm all right.
Right.
Yeah.
I'll drink more water. I might just be dehydrated or something.
Well, and education, I think, is so key with patients, and you know, lack of prenatal care, late entry into care, infrequent visits is another risk factor for preterm labor. And so, if we can encourage women to start their care early and to come to all of their prenatal visits, then they should be getting education at their visits about the signs and symptoms of preterm labor, and in being encouraged to call their physician or their hospital if that's occurring.
Susan, how many, is it a certain amount of preterm labor visits that they're supposed to have?
Yes, I mean, women should have their first prenatal visit in the first trimester. That would be ideal. So that would be before, you know, about 12 weeks of pregnancy that they've been seen at least one time. And then there's a schedule, you know, about once a month in the earlier stages, and then we have the visits more frequently towards the end.
And all of this is spelled out, of course, at the beginning to the mom.
Exactly
to
right.
the mom.
One of the things that obviously coming in for prenatal care helps is to identify those women who do have risk factors. So if you don't come in for prenatal care, you may have no idea that you're at
That's
risk.
true.
And African American women have higher rates of preterm labor. So, you know, there are some key things that really requires a much more vigilant monitoring of patients.
You know, there's a move so much about, you know, diabetes and things like that. So women who have other issues really that's high risk.
Absolutely.
Yes.
Diabetes, hypertension, obesity, those are risk factors.
Well, I know at your center at Meharry, it's the Women's Center. Tell us about it.
We actually have not only clinical care, but we also have a research center where we have basic science researchers and clinical scientists that's working on various aspects of preterm labor. It's mostly, in terms of the work that's being done at Meharry, is focusing on infectious etiology or subclinical infectious etiology and some of the inflammatory cells that contributes to the initiation of labor. And of course, structurally, I mentioned African American women, fibroids is so common.
Oh, yes.
And that's one of the potential diseases that may initiate preterm labor.
Oh, now that is so interesting. I say that because I had surgery myself once, but look, I'm doing Oprah now for fibroids. So you hit something for me when you said those fibroids because they can really interfere with things.
Absolutely.
But now, Ashley, tell us, you know, I have here the March of Dimes 2011 premature birth report card. When we talk about that a moment, that this says the status of selected contributing factors in uninsured women versus women smoking and late preterm birth. I know you ladies have all, you know, have those stats. It is March of Dimes is really. Do you want to tell us about that? Been
Sure.
tracking those things.
Every year, the March of Dimes does the report card, and it's done per state on different results around preterm labor and premature birth and unfortunately infant mortality. And the state of Tennessee has increased their grade, although it's still a D, which is frightening, I think, for the state. It's a
really is.
astronomical number of babies that are born premature and face lifelong challenges because of that. I believe it's 1 in 8.
Yeah.
Approximately.
And you know, you're right. I saw that D, and I said, Tennessee has a D. Wow.
D.
But you said that's up.
That's up. We were an
Wow.
F, I
Wow.
believe, last year.
Yes.
D's not good.
To say the least.
To say the least, exactly. So, I mean, there's a lot of work to be done, a lot of education to be done. So I think that's what the March of Dimes is trying to do, is to educate.
Exactly. I was about to say, when Tennessee's vying for the bottom, that's not a good place to be.
No, it's not.
Okay.
No.
And your program at Vanderbilt is involved in working with this too, aren't you?
Yes, absolutely. And, I think every center in Nashville is working hard to educate women about preterm labor, and certainly Vanderbilt's also involved in research around that. I think one other thing that I come across with dealing with patients is that because our NICUs have done such an excellent job over the years in improving the outcomes of preterm babies, which is fabulous, but it's led a lot of women to believe that it's okay for their baby to be born preterm. And we need to let them know that that baby is not ready. And even though our NICUs are doing a fabulous job with survival statistics, those babies are still at risk for developmental delays and issues like that and long-term health problems. So part of our education too is just to let these women know that that baby needs to stay inside as long as possible.
And you know, one thing that always gets me is smoking, and seeing women smoking and pregnant, or even a pregnant woman in the car with someone who is smoking.
Yes.
Yes.
I guess they don't understand that really makes it a high risk, right?
Yes, I mean it's a risk for preterm labor and also for a small for gestational age baby, which again some women think sounds good to have a smaller baby for an easier birth, but really they're setting their baby up for potential problems.
Oh, so women think a smaller baby it's easier because it doesn't hurt.
Right, exactly.
Oh my gosh, I wouldn't have thought, oh, okay, so the baby's small, so, oh, wow. I wouldn't have thought that. But I guess, it's so many issues out there, and I'm glad you ladies are telling us so much about this, because premature labor is something. And Ashley, I know that you have experienced this personally, and are you're on the second child?
I'm not. It was a very frightening experience, and I come to find out after I had her so prematurely that I have a blood clotting issue, and so it's was a very scary experience. So we haven't had a second.
To want to have a second child.
Mm-hmm.
Wow.
The other thing I think we probably need to sort of underscore is the fact that the infant mortality rates are so high, and 70% of that is really attributed to preterm births. So that's really a key element, that if we can stave off or reduce preterm birth rates, then we can significantly impact infant mortality rates.
Well, what are some of the things we can do? That the city of Nashville and the state of Tennessee that we can do?
I think part of it is what you're doing now.
Okay, it's getting the word out.
Raising
Getting the word out.
awareness,
Right.
educating your community and patients, knowing the importance of prenatal care, coming to those visits, really paying attention to their bodies, because there's a lot of changes that's occurring, and it's all new to first-time moms.
Well, some of the first-time moms, the younger teens, moms, might have said, well, I can't buy a lot of fresh vegetables and fruits and things, but how important is it taking vitamins? These multivitamins, is that very important?
Well, certainly the key element is folic acid in
Okay.
pregnancy. And technically, it really should be started before pregnancy, at least 2 months before pregnancy, to prevent neural tube defects, spinal bifida. So women who are planning a pregnancy should in fact take folic acid before they conceive. Now, obviously that doesn't happen all the time.
No.
But certainly early prenatal care and initiating it, because by 10 or 12 weeks, that baby's already formed.
Wow.
And I think one other thing, if we can do any other type of education with women, is just for them to understand the importance of their own health before they get pregnant. Some of the research that's been done with preterm labor is really looking at why would you expect to have a healthy pregnancy if you're not healthy entering that pregnancy? And so having women who are obese or who have uncontrolled diabetes or other types of underlying health problems, address those and work on getting themselves in a better state of health before attempting a pregnancy, I think also would help with our preterm birth rates.
Well, what about the women who, don't have the planned pregnancies?
Don't have the planned pregnancies.
that didn't know it to do all this stuff beforehand, and you're into it now.
Well, March of Dimes has had a folic acid campaign for many years and has been recommending that all women of childbearing age take folic acid every day.
Why is it so important to take folic acid, Susan?
Well, as Dr. Davis mentioned, that it has been proven in research to decrease the risk of neural tube defects, which the most common one is spina bifida, and so that's an excellent easy way to prevent what can be a very debilitating condition in a child for life.
Are there other diseases or things could happen if they don't take folic acid?
Well, not related to pregnancy so much,
Oh, okay.
but it has been shown to decrease the risk of some cancers.
Oh,
Yeah.
wow, now that's very important.
I think one of the other factors that we really haven't touched upon is pregnancy spacing, interconception. Lengths of 18 months at least has been proven to reduce preterm labor.
Before they have another child.
Yes. So, there's also a lot of opportunities that we have to make sure that women understand that as well.
So they should wait at least a year and a half before they try to have another child.
That would be ideal.
Ideal. Wow.
So trying to talk to them before they leave the hospital after their birth, make sure that they have a contraceptive plan in place.
That works.
Yeah. or they're willing to try to work at is good.
Well, now, right, a plan that works. Well, it's good to have a plan. Well, so the things that you can do is once you find out that you're pregnant, is to at least take folic acid, go to see your doctor, get a plan.
Yes.
Number one, get a plan. Go get to work on a prenatal plan, and follow it.
Yes, follow the plan.
And there is sort of an initiative around the country looking at centering pregnancy programs, which is a group pregnancy care program. And a large part, I think, of the benefit of that program is the education that the women do get. We talk about not wanting to bother your physician, your visits being rushed, whatever it is. But this gives them the opportunity to talk collectively as a group about topics more in detail. And then it also provides a support group for these women who are going through centering pregnancy. And we were very fortunate. One of the things that Governor Bredesen did was actually set aside dollars to establish centering pregnancy programs throughout Tennessee, because it is such an important concept.
Centering pregnancy program, and we have several of those kind of programs here in Nashville.
We do. We have one at Meharry, we have Vanderbilt, and one of the other clinics.
Oh, and they're open for women to go and free of charge?
Yes, it's just part of their prenatal care. It's simply a different model of delivering that care.
Oh, that's nice.
They group them with other women who have a very similar gestational age. So usually their pregnancies are within about a month of each other. And so they come in for their prenatal care together, usually about 10 of them in a group, and have about a 2-hour prenatal visit scheduled. And so they have time individually with their provider where they can have their blood pressure checked and baby's heart rate monitored and all of those types of things, but then also have some time for education and then time just to visit with one another. And how's your pregnancy going? And and then talk about how do you feel, and have you had this problem? That type of thing.
Sort of like a group therapy.
Group therapy.
Yes.
That's nice. And those are there are several of them all over Nashville.
Yes.
And they are advised when they come in
Yes.
that that's available.
Yes.
Yes.
Well, so these are all good things, and see now that the average would know about. That's very good. And so the things that to help prevent preterm labor is to, of course, take care of yourself beforehand if you're trying to, conceive. But if it happens, it comes up on you, don't know it, to at least get immediate care.
Yes.
And,
Absolutely.
And follow that plan that the doctor tells you to do, regardless. And those that are at high risk, the former smokers and diabetes or other kind of issues, really have to take even special care.
Well, it's preferable that they get preconception care because there's so many important elements that needs to be controlled, particularly when you're talking about diabetics.
Okay. Oh, well, that's true. Well, this has been an interesting topic, ladies. Thank you so much for appearing on Loverick and Company. And talking about preterm labor, because this is a very, with the state of Tennessee and Davidson County with a D grade for premature births in Nashville, we have a lot to do and helping to get the word out and to help women. And thank you so much, and for all the work you're doing at Vanderbilt too. And Ashley, thank you.
Thank you.
And Dr. Rashad Davis, thank you.
Well, thank you for having
And
me.
thank you for watching Loverick and Company. We'll see you again next time.